All right, welcome to the ADHD and learning disabilities session. So we're really excited to be here. And as you introduced, my name is Dr. Susan Wamithi. I'm a developmental pediatrician, and I'm also the chairperson of the EACD, which stands for East African Academy of Childhood Disabilities. And so attention deficit hyperactivity disorder is a hidden disability, and it's part, of course, of our neurodiversity. These are children and adults who struggle with attention, and they struggle with hyperactivity and impulsivity, which gets in the way of how they are learning, how they're engaging with other children, and really gets in the way with, when they're older, with keeping a job and even relationships. And learning disabilities, of course, also get in the way of how children are understanding information. And we're going to be hearing from our panelists about what they're doing to accommodate these individuals in our learning institutions. And so the session will really delve into ADHD and learning experiences, especially in the African context. And what does supportive and inclusive education and work environments look like? Even as much as we are highlighting the barriers such as difficulty with diagnosis and inclusion understanding, we really want to celebrate the amazing work that's being done by African scholars and African institutions so that we can understand what attention deficit hyperactivity disorder looks like in our setting. And really, there's been groundbreaking work. We're looking at genetics for ADHD for African populations so that we can be able to find a way of reducing stigma when people understand the biology behind their children. And even we are using artificial intelligence to build capacity for our healthcare workers. And so the Kenya Pediatric Association, where I serve as project lead, and Dr. Rosemary is also here as a project lead, we're really using AI to revolutionize how we are training healthcare workers. These are pediatricians, nurses, occupational therapists. And what we're doing is that we're writing clinical simulated scenarios that the artificial intelligence is actually implementing in terms of having those healthcare workers who look like us, who are Africans, have our accents, and really ensuring that our projects are reflecting our continents as Africans. And so we are really moving from our, to have inclusion from our classrooms to our workplaces. And so we're going to have candid conversations today. And I'm going to go down the room to introduce our amazing panelists so that we can have candid and solution-driven conversations on how to advocate, how to have early intervention, how to have inclusive designs when it comes to ADHD and learning disabilities. And so it's my pleasure to start off with Neema Wanjiku Maina, who's a student at the Kenyatta University pursuing theater arts and film technology, but most importantly, she's a young person with lived experience. She has ADHD, and so she'll talk to us about her experiences and what we can do better for the young people. Welcome, Neema.
Okay, thank you for that lovely introduction. My name is Neema Wanjiku. I'm currently a student at Kenyatta University pursuing theater arts and film technology. I'm also currently a volunteer at Kenyatta University Television as a news director. I'm a social media manager, a graphic designer, and many things at once. So, yeah. I'm also a person living with ADHD. Most of you would think, okay, honestly, I didn't think ADHD was a disability until being told it was a disability. I see it as a superpower because I can do many things that most of my peers deem that it's too much, but for me it's kind of good. So what I'd like to say is, sorry, I have too many notes. So they are currently in schools. The reason why you think, when you normally think of ADHD, you think of an hyperactive kid who can't sit down, who can't concentrate, who can't do anything. But there are many things that also people don't consider. ADHD, they say attention deficit, but they can keep attention. You can hyperfocus on a task for like 2 hours. For normal people, you can hyperfocus, then you get tired, and that's it. But for ADHD, honestly, there are days that I have to force breaks. I have a set timer on my laptop. When I've stayed in an app too long, it closes the app. That I stop, like, to prevent the hyperfocus. There's also people not understanding what ADHD is. When you go to school and you tell them, hey, what's wrong? They ask, what's wrong with you? I say, oh, I have ADHD. I need a break. They're like, no, what's ADHD? Oh, Nini, they think you're making something up. Ama ni ugonjwa ya wazungu. The disease of Americans or Europeans. They say that. So it's, in schools also, that gap of they don't know what it is and they see you as normal and they think that, oh, she's just overreacting, or oh, she's just not paying attention. Yeah, and then I think I've expounded my answer.
Thank you, Neema. And I just had a question. So what can we do for us who are working with people with ADHD, teaching children with ADHD, or even healthcare practitioners who are seeing children with ADHD? What can we do to ensure that the spaces are real to you and that we're creating an inclusive environment for you as a young adult?
Okay, so an inclusive environment for me as Neema with ADHD is give us, like, we need movement breaks. Like, I don't know how to explain movement breaks, so bear with me. A movement break is whereby we have gone through like in class. Let me use class as an example. We have gone through a 45-minute lesson and you want me to transition to another 45-minute lesson. My brain is off, honestly. Concentration span, yes, we can hyperfocus, but sometimes our concentration span is very little. Understand that we are not slow learners, but the way our brain processes information is different from the way normal kids do. Also, you as an educator, educators especially, or even in office meetings, you're not involving me, not asking questions, you're just talking. Yeah, my brain will just switch off, honestly. And using visual, like presentations in meetings, videos, that like serves as a break for us. Because our brain is now, you've talked so much, so our brain is now like, okay, now I need something else to do. Another thing that can be done is, in schools especially, for people younger than me, is coaching us on how to organize. Literally, that's a whole area of ADHD that if you're a parent of ADHD, you know that we are very messy or very disorganized. Not only, disorganized in the sense of we can't put our time together. And we need systems to check our staff, to check meetings, constant reminders of meetings. And teachers hate that we don't always remember deadlines. Hey, your assignment is due on Monday, but you don't, there's no a checklist. I have to create the checklist on my own. And most of the time in schools, people who have passed through the Kenyan system, that doesn't exist. Creating organization boards, creating checklists, that doesn't exist. Also, just know that ADHD is not the same for every human being. Every person with ADHD, we are all different. So if it's being inclusive, it's supposed to be need-based. There's someone who's highly functional, they can be organized, you can be nini, but their emotional regulation is very low. There's someone else who has very good, they're high functioning, but there are some aspects in life that is very difficult for them to do. Remember that a person with ADHD is very hard to complete tasks that you normally think, this is easy. I have an alarm to remind me to brush my teeth. And it's not at, I just dispose of it. It's more of my brain sees it as a huge task, and it's something so small as brushing teeth. So I think including us as people with ADHD neurodivergency is more of make your spaces more dynamic, in short. Yes.
Thank you very much, Neema. And now we'll go to Lambert Onderi Oigara. He's a psychologist with 20 years experience in the field of mental health and works with children, adolescents, and adults, and really believes in the power of the mind and how it influences our thoughts and our feelings. And Lambert has used CBT techniques, which is cognitive behavior therapy, to assist and help clients identify a core belief and how it influences their lives negatively, and for them to come up with positive adaptive coping strategies. He's a pioneer of ADHD support group in Kenya, which has helped hundreds of youth and families with attention deficit hyperactivity disorder symptoms and how it manifests. He's also the executive member of the International Society of Substance Use Professionals and affiliate member of the Kenya Psychiatric Association. And so over to you, Lambert. Thank you.
Thank you, Dr. Susan, for that introduction. I'm dressed in a black checked jacket and a white checked shirt, and I'm wearing denim jeans with black shoes, and my socks are black as well. And I'm also wearing spectacles. Of course, just as Dr. Wamithi has mentioned, by history of just interacting with children, adolescents, and adults with ADHD goes back to the year 2003. And then I was a novice professional psychologist. Actually, I had a diploma then. And I was taken into a psychiatric unit, and under the guidance of a renowned professional called Dr. Frank Jenga and his team, we were able to actually spend a lot of time interacting with children, adolescents, and adults. And what we used to do is do a lot of observation of behavior of children who are very hyperactive, would not sit still, would not really listen, would have problems with eye contact. And the report was that this child is lazy, that is what we'll hear from the parents, or this child is stubborn, and they would come with school reports where they've reported that this child's performance is inconsistent. There are subjects that they really enjoy where they'll do extremely well, and there are those subjects that perhaps they don't like the teacher or they don't like the other students or whatever it is in class, and then they'll perform very dismally. And you'd find that these are the children where you'd work with, and in some instances where children had severe ADHD, then we would start them on treatment. So we combine treatment and what you call a behavioral program or behavioral intervention, where really you have to come up with a system, just like Neema has mentioned, make sure that then maybe we didn't have smartphones at this level, advanced and smart watches. So we would actually make sure that we help the parents and work with the teachers to set a system in place where the child has some kind of consistency. It's consistent wake-up time, it's consistent sleeping time, time for playing, time to study, taking breaks between their studies, etc., etc. And I must say that set a very good foundation for me, whereby a few years later, in 2005 or thereabout, we started the ADHD support groups. And I think just like my colleague Susan put it well, those support groups have continued supporting hundreds and hundreds of people. But unfortunately, during COVID, they took a break. And sadly, we stopped having physical sessions. And we went online. And sometimes with ADHD, follow through and all that, then things maybe went quiet. And it's been like that for some time. And we are trying now to revive that. And I'm so glad that I'm here with my colleagues, and I believe that's something we can pick up. So that's enough, I guess, with my introduction. I think I'll share more later. Thank you.
All right. Just because of the time, I'll just ask you, Lambert, in what way does culture influence how ADHD is understood and treated within the African context and within our communities? For you as a psychologist, what do you see?
Of course, when you think about our contexts, we are a very collectivistic society compared to other contexts where they're individualistic. Although times are changing, but deep down you'll find that even the older generation tend to be collectivistic. And by this I mean we live in a community. You'll find that in our contexts, our parents will say that you are my child regardless of how old you are. Even when you finish school, you're married, you have a job, your mother will always say that you're my child and you're my son and you're my daughter, and I'll always perhaps kind of step the boundaries or go beyond the boundaries. So you find that in our context, sometimes unknowingly, and we have to understand our parents will go too far when it comes to people who are neurodiverse or people who are ADHD. So you'll find that within a context where a child has ADHD, you find that parents are always kind of supporting them and holding them, going everywhere they go. So when they get that stage where they need to have autonomy, then it can become a little bit complex. So you'll find in our clinic that many parents will come and they would want to actually know what you're discussing in the session, which then, of course, it's unethical. The parents would want to be involved in every screening and assessment session and wanting to know everything. Then it becomes a little bit challenging in our context, whereby this child might actually feel that my parent is overbearing, my parent is not understanding, and is not supportive. And then it starts bringing challenges. And that is why even in our context, we try to use CBT to also not only educate the parents about perhaps some of the limitations they could be having that would make them want to impose their values or their ideas on their children, but to also strengthen them to have coping skills of their own. And perhaps even realize they themselves could be having ADHD, which is making them extremely anxious, and as a result, subconsciously they are trying to live through their children so that they make sure that the children don't get ADHD. Another thing would be, you find in a context, you find a child is really kicking in the stomach, then the mother would call the child, for example, patients. Our names really matter in our society. So the child comes out and they say, my child is patient. And everywhere they go, they call them patient. But the reality is that this child, from the time of conception, because they were kicking too much, they reminded them of themselves when they were very hyper. So you find that then they believe that if they call them patients, then the ADHD will just disappear. And sadly, then that does not go away. You can imagine the frustration that comes with that. As a parent, you are always anxious, and perhaps even you might get depressed because you're trying to do everything for this child to make sure that when they get to teenagehood, which again in ADHD, there's a tendency of children getting into addiction, they are vulnerable to that, and so forth and so on. So you find that perhaps if as a parent, you went through teenagehood and you had a little bit of challenges then when they are teenagers, then you're on their case. And the story goes on, and perhaps in our context, it evolves in a way that there is a strained relationship, which then, clinically, when they come to us, we're able to rule that out and pick it and then work holistically. Which brings me to the next point, involving families. Even if there's an element of confidentiality, sometimes if the client is willing to involve the parents, we are able to actually have a better results compared to sometimes when there are all these things going on and we only focus on managing ADHD and managing the client without involving the parents in this activity of trying to help them. I guess in the interest of time, I'll leave it at that.
Thank you very much, Lambert, especially for bringing in the role of the parent. And so I want to introduce an amazing parent, Dr. Sylvia Moraa Mochabo Akinsiku, who's a caregiver of a child with ADHD. And most importantly, she's founder and executive director of Andy Speaks for Special Needs Special Needs Persons Africa. And really handing over to Sylvia to just tell us her experiences. Thank you.
All right. Thank you, Susan, so much for the introduction. Akinsiku from the West. Right, it's usually very easy but complex at the same time. So like she mentioned, Sylvia is my name. I have 3 boys and 2 of them are on the spectrum, plus the last one who has ADHD. And let me break it for you now. I am also on the spectrum with ADHD. That I got my diagnosis earlier, and when Lambert was talking about it, it was like, oh yeah, actually, that's what we do, you know? But then the difference and the diversity, as Neema said, is my child and myself were very different, and I find myself trying to understand his, you can do this, you know, you want them to settle down, focus, you identify things in them, and you want them to be able to perfect it. But then that, me being a hyper-focused person, him being more the opposite of being everywhere. It makes things like learning very challenging, that every time I'm like, I'm supposed to teach this child, I'm like, I can't do it. Because there's a conflict of my ADHD and his ADHD, and how do we balance off each other? Most parents get frustrated, that is a given, because for me, the unfortunate or fortunate element of it is that having 2 of them, 2 totally different individuals, because the first boy and the second boy are nowhere even on the spectrum the same. One is very friendly, the other one is not friendly at all, but you have to coexist. You have to try and teach them, identify who they are. And that was actually the background behind why I started Andy Speaks for Special Needs Persons Africa, just to bring in the voices of our nonverbal children, and at the same time, the parents who don't even have time to stand up and fight for themselves. Because you're busy trying to raise this child, you're busy running from one appointment to another, you're busy trying to find school, and there is rejection left, right, and center. First, because people do not quite understand what's wrong. Because most of the time, the first thing you see, because in hindsight, when I look back when I was growing up, there was the standard complaint, too playful, right? And the element of having boundaries, deadlines, like she said, I'm in class, yes, I will perform. But the time I was given a marker, and I always tell people, like, if you don't give me a deadline, it's very hard for me to actually get things done. And that's what neurodivergence is about. If you tell me I can do it, it will be relegated. I don't like procrastination, but then now that's what gives you a marker, a timer, like, I have to do this by this time. And with that in the education system and just generally growing up, it makes it very, very difficult, especially for the transition, where you find yourself how our primary school life was and getting into now the high school, where you're supposed to be your own person. And you're trying to teach this person who has all these things, like Neema said, to manage for themselves, yet you need that guideline. That, oh, we are here now, we are there next, and etc. So under the organization, we formed different programs to try and support children with developmental disabilities, that is autism, ADHD. And remember, neurodivergence comes with comorbid conditions. So you find the most common one being epilepsy. So you're also juggling that element of, and I know this is something that when Dr. Wamithi was seeing my son, I'm like, so do I focus on the ADHD? Do I focus on the epilepsy side of it? Because sometimes things will come and you don't know what it is you're addressing. And right now, even in teenage, I'm like, how am I going to balance this person who's discovering himself, wanting to know things, is not very good with boundaries, because like I said, they're different. So one is very, very social, everyone is my friend. And in our community, the rejection, the lack of understanding, the branding of children, because the first thing will be like, this child is just too hyper, this child is unruly, yet it is something that's over and above. So as a parent, you're just taking in the punches on their behalf, because you see the purity of their soul, they don't realize that this is not right, or rather, because now it is their personality. And as a conflicted parent, I'm like, if I tell him stop saying hi to people, what am I doing? Am I changing who they are? Am I aligning with society these days? Because when we grew up, the child belonged to the community. We used to say hi to each other everywhere. I know you, I don't know you. We'd have that conversation here in Africa. But right now, we've become so much in silos that even when a child says hi to you, it's like a weird thing. So do I change this child and tell them, don't do this, or do I let them be the different person that they are? So those are very many conflicting things that we find in raising now special needs children.
Thank you so much, Sylvia, for highlighting that. And reflecting as a parent and a person of lived experience, with the new Kenya Disabilities Act that's been set up to leverage those educational opportunities, those social opportunities, and the inclusion in schools, what does implementation look like?
So this one, I'll take it from as a former board director at the National Council. The processes and one of the challenges that you find that we have in our country, we have beautiful policies. Very beautiful. Everywhere you go, the act is there, policies are there. Every department says that we're being inclusive. We have 5%, but we are hoping that with the new mandate of the council that we're going to be seeing more of implementation, because there is no need of having a dog that cannot bite. You know, you'd rather than have a pet, like a cat, you know, instead of, of doing that or giving a name and responsibility to someone, you're not giving the powers to be able to correct. So it's a call upon everybody to see from the act, first being aware. So awareness of what is actually in the act. And then implementing. If we're talking about inclusion of caregivers, because this is one of the greatest journeys in the past 20 years, and I know when we're out in policy spaces, and there was a point when we had to sit before Parliament to justify. I remember we were with parliamentarians, the ones who had been allocated to this act, and making them understand, why do we need to give you more money? Why? And that brought me to now the lived experience where it is also important when you try and explain, like, if it is school, my child is not reading like your other children. So when we're looking at the education element, that means the Ministry of Education has to look deeper at the equity of how do we make the neurodivergent children and those with ADHD be able to sit in class, like she said, settle down, provide with the right assistive technology. And the diversity of also neurodivergence also comes in play when we're looking at the budget that we are allocating. If we're not going to be giving support aides and support teachers in the classes for our learners, because you see the difference in the disability space, the neurodivergence is on the other side, if I give a braille, that is it. That child is sorted. But for our children, it's totally different because there's the multiple levels. So for the act, the implementation element right now that's going on is that everyone has to now plug in. Whoever has been given responsibility has to put in the policies in place. For example, everyone is now looking at the KRA element. We want the tax relief. But what's coming out in our support groups now from the parents is, what about me who's not working? How am I benefiting out of it? So we solved one problem, but then we have something else that's creeping up, because the complexity of caregiving makes it almost impossible to keep your work. So when we're talking about implementation, also the employers have to also meet us halfway. And when we look at employability of neurodivergence, I always say that in our context here, we are disadvantaged while the rest of the world is moving to employment. We are not yet ready to talk about employment for the neurodivergence because we've not given them the right healthcare and access to early intervention. We've not given them access to the right education. Yeah, we don't have institutions that are equipped, the classes are crowded, so all these things have to come so that we can be able to open up these opportunities that we have in the Act, like the 5%. So, and we are hoping that it will be in due time and there won't be so much bureaucracy that we don't even get there.
Thank you so much, Sylvia, for especially highlighting what implementation really looks like on the ground and the aspect of the caregiver who's not working, which really needs to be explored because of the demands of their situation. And our last but not final panelist is Naputuni Nyoike, who's Order of the Grand Warrior. And for those who are not Kenyan, it means it's the Kenyan highest honor for service and excellence in education and advocacy. And Eva is a distinguished expert in special needs education, a passionate advocate for inclusion, and a trailblazer in the field of neurodiversity. She's the founder and director of ACON Special Tutorials, the CEO of Africa Special Needs Education Network, and was a technical advisor to Her Excellency Margaret Kenyatta, the former First Lady of Kenya, on disability issues. She holds a master's degree in special needs education from Walden University and her undergrad in special education from Lockhaven University. And especially, she's a mom to two amazing children and one with ADHD. Welcome, Eva.
Wow, thank you. Good morning, everybody. Good afternoon, everybody. All right, thank you very much, Dr. Susan, for this. Yes, I am a mom also. Actually, I'm a mom to 5 children, and 2 of them are on the spectrum, not spectrum, well, they are neurodivergent. Our third born has ADHD, We call her the mother of all ADHDs. And our last one has Down syndrome. So I'm happy to be here just to share some of the things that we can do, because you've heard I'm also a director of a school. And when it comes to education, and you've heard what Neema has said to teachers, I've just been writing my notes, and it's true. As teachers, as educators, we either make or break the children. And that is because we try and put them all in the same box. We've just heard from Neema, we've heard from Sylvia, that these children are not the same. Not one child is the same. If they all have ADHD, whether they are neurodivergent or not, they are not the same. So for me today, I'm just going to try and see, how do we now make learning fun? Because I'm a teacher, and as a teacher, you want to also enjoy teaching. So what has technology done for us? One of the things that we've realized, and it's very important, for example, is that we need to encourage our learners who are neurodivergent to use what makes them work. You heard about Neema saying that you need some time breaks. There are learners who will only work if they had headphones. Why do they need those headphones? They need those headphones because they're concealing all the noises around them. Neema said, and I'm going to use you, Neema, because you're a student, I'm a teacher. Neema said about hyperfocus. They will just hyperfocus on things, right? So they need to cut off all the noise and be able to focus on what they're supposed to do. How else can we help these learners, especially if we're using technology? Again, Neema mentioned the fact that they need help with organization. If we are too busy in class, minding every other child, but not the child with ADHD, we tend to lose them. So things like smartphones, things like timers that can actually alert the learner it's time for transition, those are things that should be allowed. And as you're saying, Susan, and Sylvia, about the Act now, and talking about accommodations and modifications, I think we need to go further, because what happens is that everyone will get their accommodations, but what about the neurodivergent learner? So having them being allowed to have a small little alarm, maybe they're the only ones who will hear it, that will help them be able to know it's time to transition. Small devices like biofeedback, just to get some feedback from you, what's happening in my system. Sometimes the learner can get a little bit stressed and they can see their heart rate. Now, once you know that they have that device, you're easily able to redirect them. Get onto the app, get onto a mobile phone, get onto a tablet, and show them how they can now use it to relax. You see? So we are using gadgets to be able to remind our learners that it's okay to be you. And the way Neema said that without that support, without that place where the learner feels embraced, a place where the learner feels that they are welcomed, learning will not happen. So we are going to use gadgets now to try and incorporate that. What else can we use? You know, the mobile, as I said, mobile applications. We have the, what we call them, task management apps. There are so many of them. We can try and look out for those ones, because they will help the learner be able to understand, break down tasks according to their levels. We have computer-based technologies. And I'm talking about all this because they have helped my daughter. When I said my daughter has ADHD, we have seen the changes that technology has helped in having her be able to calm down. She's able to know when to transit from one place to the other, or when to transit from one activity to the other. She has an app that has mindfulness. She looks at it when she needs to breathe in, breathe out, and it's actually quite interactive. And these are things that really should be encouraged in our school systems. So when it comes to our local Kenya system, there's a lot of problems with allowing learners to use computers in class. I think it's important that learners, especially the ones on the spectrum or the ones who are neurodivergent, should be allowed to use computers to help them demonstrate what they know by using something that we call a learning strategy called Universal Design for Learning. So we need to introduce things like computers. So as a teacher, we are actually right now challenged on how do we ensure that our learners with ADHD actually excel in school. So we are looking at issues of policy, we are looking at big-time technology, we are looking at training of teachers so that they can be able to appreciate what can technology do for our learners. So together, being in a conference like this, it's important to now start bringing in on board, how do we bring in technology? Yeah? How do we make it okay for a learner to go and do the exam using technology? We have text to speech or speech to text. Can that be used in our classrooms? Can they be used when you are doing the assessments? So when it comes to technology and children with or learners who have ADHD, I think this is the right time to start introducing technology into the schools. Yeah.
Thank you very much, Eva. My question is with regards to transitioning into the workspace, the role of the educators, and how do we help employers realize their role in terms of being supportive as we're transitioning, in terms of that extra technology that's needed at the workplace?
Yeah. What is very important, first of all, is to appreciate that there is legal binding. There is a law right now, yeah, that the employer, you remember the 5%? Yes? But you don't just employ for the sake of employment. By the time you're employing somebody who's neurodivergent, your office or your space, the employment space, must have gone through a disability training so that they can know how to include this person who needs extra accommodations, right? And through this disability training, they will bring in the aspect and the components of technology. So people need to be schooled in that and to know that the technology will make the person who has been employed and has a disability much more effective. So if you're looking at production, efficiency, why not use technology? So it's to introduce technology and to train the work environment on what this technology is and how effective it is and important it is for that particular individual. Yeah.
Thank you very much. And so we're going to open up the floor for any questions for our panelists.
Hi, everyone. It's Maureen Sharon again, sorry, but you'll just get used to it. First and foremost, I would like to congratulate all the caregivers. All of you just do. It's not easy, yeah? It's not easy on our side. It's not easy, especially when it comes to education part of it and the stigma that we pass through, especially in our community. Some of us pass through with our parents at home, but we still keep on keeping on, yeah? So personally, I have this question, especially in education and for our caregivers. And I'm not giving the panelists only, but this is a homework for all of us OPDs. I like giving homeworks. So my question is, as OPDs, how can we come up with the way our last panelists have talked in the digital part of it, of our children to do exams, because to be sincere, our children are more bright and they're so blessed with our things to do with IT and everything. And again, this is a homework for each and every organization and partners who are here. We speak about our children and we'd really like to hear their voices. If it can happen, we'd really like to hear their voices on what they pass through in the community and at school, where they go and with their friends. Because we can't be talking about them, and yet some of them can speak about what they feel. My second homework is for caregivers. We are sick and tired of this issue. You even want to say hi for your relatives, but what they think for you, they take you as a beggar. Is it true or it's a lie? What steps can we make as caregivers for us for our community or our relatives or our friends to stop looking at our phones when you call them and see like we want to beg and we just want to say hi? So we would like to request all the stakeholders, kindly, we know some of our caregivers can go to work and we know some of them can work from home. If you have any job that can empower that caregiver, please, let's empower our own caregivers. Thank you.
All right. Thank you for your comment. I think we had a question here. And just because of time, we have 2 more minutes to just make it concise, please.
Good afternoon. I think for me, my question is inclined to the workplace. So yes, we do have, we are working on training the teachers to be more inclusive. We have some of the accessibility tools in learning, but how do we ensure that the transition is happening seamlessly at the workplace? Yes, we do have laws, right? Yes, the trainings will happen, but typically in the workplace, the biggest barrier that exists is it's expensive. Right? So if I need to invest in the tools, there's a budgetary implication, 1. 2, we have seen the invisibility on even invisible individuals at the workplace. Those with invisible impairments, they're not visible, right? How do we ensure we are building safe spaces for persons with ADHD and learning disabilities in those spaces? Because typically they are seen as incapable, disorganized, inefficient. They're not able to see the task to the end. You know, you've got 20, 25 tabs open, and therefore you're not able to do the thing that you should do at that place, right? So how do we ensure that the workplaces are accessible, inclusive for these individuals with invisible impairments, and that it does not have a high cost implication when you're doing the pitch? Because I know I've been on that side where I'm doing the pitch and they're like, let's try the easy ones first.
I was either Lambert or Eva, because I know you work with adults.
Can I answer that?
Yes, please go ahead.
Okay, one of the things that we need to do, and that is why we keep celebrating this new bill, is first of all, we need to create that awareness, because it's an invisible disability. You will only see according to their behavior that there is actually something going on. And I can tell you as a fact, is once you understand that this person has ADHD, then your attitude towards the person will change the way you respond to this person, because you will already expect certain behaviors from them, and you already know how to deal with those behaviors. The area of the fact of saying that it's expensive, we need to think about it. What will change? What is that aspect that we are actually looking about? If it's adding a ramp, that is fine, but persons, this is actually something that is considered as a law. You need to have these things. But what you're looking at is probably, is it assistive device? The little timers are already on their phones. Our phones are already accessible. Whatever we need to put for them, like organization, just helping them be able to organize their daily schedule, it's already on their phone. So we will not need to change the environment too much. What is actually advocated for is use what you have, so that we don't have that notion that if I employ a person who's neurodivergent, it's going to be too expensive. So it's, let's see, what do you already have? How now do we modified to be able to make you more effective and more efficient. And of course, we have to remember that we need to treat them with dignity. Yeah? So how do we dignify that? We don't put a big thing, border saying X, Y, Z, please watch out, so and so will leave the taps open. We need to treat them with dignity because they're able and all they need is actually a chance. Yeah? You want to?
Just to add on to that, I think I mentioned a little bit about the history of ADHD in Kenya, the past 20 years. And I think the reason why we are here is mostly because of the programs we used to have in schools. And when you look at schools, right now maybe you might not really talk so much about that because there are a lot of programs in school where because of proper diagnosis and information, and we usually say 90% is understanding. Once you understand these conditions, then you're able to accommodate these people. And because these conditions are invisible, you have to focus on the individual. You cannot just say it's just going to have a blanket statement that all the guys who have ADHD, this is how we are going to manage them. When it comes now to employers, we need them to use the same metrics. Information, do these employers really understand what ADHD is and how it presents differently in adults? Because in children, one will be very hyper. An adult is in a meeting, they are bored, and they start being restless. They start doodling, as we were discussing with Neema earlier on, and then they're in trouble. So if you're able to accommodate them by understanding and empowering the employers, and also having them involved in having warriors within the institutions that we have, whereby you have advocates, individuals who are not necessarily ADHD, who can advocate for these people with ADHD. Setting up such systems goes a long way. And those are some of the things that we are doing in certain environments, and we're empowering employees, and they're like, we didn't know this, and this is amazing, and they are noticing a 360 turnaround rather.
Susan, can I top up just 1 second? On the element of cost, just from lived experience, we are actually more productive than your typical employee. Personally, every job I left before I was independent, I had to be replaced by 3 people. But there was the level of, I gave my conversation when I was being employed with the HR. It starts from HR when you're employing. Have a conversation with me. You report at 8, I'll be like, no, I'm comfortable with 9, so that you're not giving me the anxiety every time I'm coming in, I'm feeling pressured. Because I am a morning person or evening person. Meet me halfway. When I'm having a hyper, like a meltdown, or times when I can't take it, give me that person that I can have a conversation with, and then look at that from an open mind, not a judgmental mind. That way, when you have that freedom of conversation with the people in the right spaces, and that's what reasonable accommodation looks like. The expense of, like, say, for me, I walk around with my fidget spinner, right? When I'm anxious, when I get to that space, I'll have it. I'm not disturbing anyone. I've not asked for any extra cost. It's mine. It will just take you understanding when I'm in a meeting, because sometimes I will interject. I'm not interjecting because I am rude, as our community will look at it. I'm interjecting because when you say something, my brain is working too fast. I finished before you started because you just prompted. I have 5 files running behind my head, and if I don't do it now, I will lose it. And I'll be playing catch up with now what you're saying next, because my brain already went to whatever you prompted in me. So most of the time you'll find, like, even in meeting settings and such areas, we just blab out. Like when he said his socks are black, in my head already I was like it was here, but I was like, no, it came out, it's involuntary, right? Not to be rude, but then it's just what's within and how your brain works. So when you start that conversation from the HR point, then if it's a policy and I say this does not work, it's just having that conversation and trying to understand where I come from and what it means for me to give you the 100% of my time. Yeah.
Just because of time and Lisa is standing over me, I just want to really thank the panelists because you've been vulnerable to share your stories. We don't even take that for granted. And I really want to encourage the audience, remember the people with hidden disabilities or invisible disabilities, because we need to look at the strengths. I love the many projects that you described that you're involved in, the many projects that we know Sylvia is involved in, and seeing those strengths and seeing the support systems that caregivers have, psychologists have, and even us as medical practitioners have, and ADHD, those who do well, examples, of course, we all know Richard Branson, so let's encourage our parents to look at what the future holds and for us to support them. So we're handing over back to you. Thank you, no pressure.
Thank you very much. This was a very informative panel. I mean, sure, we had so much interest in it. So well done to the panelists and our wonderful moderator. Can we please give them a big round of applause?